Matabeleland South Province health officials have expressed concern over the low HIV risk perception among young people, Generation Z, noting this generation was contributing to the high new HIV incidences in the province. Speaking during a media briefing in Gwanda this Tuesday, National AIDS Council Manager for Matabeleland South, Mgcini Sibanda, expressed concern over the elevated HIV prevalence and incidence in the province in adolescents, girls and women. The province will this year host the World AIDS Day commemorations marked on December 1. We give you more in the following report.
Matabeleland South Province, the host of the World AIDS Day this year, remains highly burdened with HIV, with a prevalence rate which is higher than the national prevalence. The World AIDS Day commemoration seeks to raise awareness, honor those who died, and highlighting the progress and challenges in prevention and treatment. With this year's commemorations running under the theme Overcoming Disruption, Transforming the AIDS Response, the National AIDS Council believes efforts should focus on reducing low-risk perception as the country moves towards the end AIDS goal. The province has a population of 700,000 with 89,000 people on treatment.
Maybe the adolescents and the children, where we still continue to see, if you look at the number of new infections, we continue to see high numbers of adolescent girls and young women who get infected. Then as a strategy that will attend to that, because in majority of cases they are having sex with older people, men, what we call intergenerational sex, where men, they have power and influence.
The province is pinning its hope on the newly introduced HIV prevention injection, lenacapavir, noting this will be critical in closing new infections in vulnerable key populations. The approval of lenacapavir creates a new opportunity to strengthen national HIV prevention systems, especially at a time Zimbabwe is already using oral pre-exposure prophylaxis to reduce new HIV infections in vulnerable women.
New biomedical intervention of pre-exposure prophylaxis injectable will go a long way in addressing those inequalities and vulnerabilities. Currently, those female sex workers and adolescent girls and young women who are taking the PrEP were taking the pills or the tablets. Again, because of stigma, they will really hide from their sexual partners.
Research has shown that economic challenges and social and cultural practices are some of the factors predisposing girls and women to HIV. At national level, the country has been working to enhance social support for vulnerable women and young girls in a multi-sectoral approach in order to change harmful norms and practices. The province over the years has employed various biomedical and behavioral change interventions to close the tap of new infections. National AIDS Council, the country's HIV response coordinator, believes deliberate economic empowerment of women and girls remains key to ensure girls are less vulnerable. Reporting Rosette here, I am Mirira in Gwanda, Matabeleland South.